Okay, today we're going to pick up with Chapter 18 and talk about our gram-positive and gram-negative cocci. And I'm going to make the videos for this chapter a little bit longer because it's just not an easier way to break them up. So be mindful of that. Staphylococci is a common inhabitant of your skin and mucous membranes. The cells are gram-positive, and they're spherical, of course, because they're coccus, and they're arranged in irregular clusters. They don't have spores or flagella. Many of them have capsules, and we know of 31 species. And this is what they look like. You can see Staphylococcus. They're clusters of round spherical cells. Now, this is a table of different organisms and how they affect your skin or your skeletal systems or your nervous systems or your cardiovascular and lymphatic systems, your gastrointestinal system, your respiratory system, or your urogenital systems. So you can see looking at this that Staph aureus that we're familiar with, of course, can cause pneumonia in your respiratory system, in your cardiovascular. It can cause endocarditis, where the lining of the heart is infected or inflamed. And then in your skin, you can get impetigo or boils. You also see down there the Streptococcus pyogenes, that it can cause scarlet fever or rheumatic fever or pharyngitis and sinusitis. Continuing with that, you got the Enterococcus. Usually you're going to have problems with this with wound or surgical infections or urinary tract infections. And of course, Streptococcus pneumoniae can cause pneumonia, otitis media, which is ear infection, sinusitis, and pneumococcal meningitis in adults. Now, looking more specifically at Staphylococcus aureus, this is considered to be the most serious Staphylococcus pathogen. The colonies are large, round, and opaque, and it can grow anywhere between 10 degrees Celsius and 46 degrees Celsius. The optimum temperature is 37 degrees Celsius. It's a facultative anaerobe. Grows best when you have oxygen and carbon dioxide. It can withstand salty environments, extremes in pH, and high temperatures, and there are many virulence factors associated with Staph aureus. This is what it looks like. You can see the hemolysis that's happening there, caused by the toxins. Now, this is the table of the virulence factors of Staph aureus. You can see there are enzymes there that digest blood clots, digest the connective tissue of the host, that can inactivate penicillin, making it resistant bacteria, that can lyse your red blood cells or your neutrophils. Your macrophages can cause vomiting and diarrhea and nausea. And organ damage. So a lot of virulence factors there. As far as the epidemiology and the pathogenesis of it, it's present in most environments where humans are. And it's readily isolated from fomites. Healthy adults, 20 to 60% of them are carriers. And it's usually in the anterior nares, the skin, the nasopharynx, and the intestine. Infections are more likely if you have bad nutrition or poor hygiene, or you have some sort of injury or primary infection. Also, people with diabetes or that are immunodeficient. And this is causing an increase in MRSA, the methicillin resistance that we hear so much about. This is an abscess of the knee that's caused by the methicillin-resistant Staph aureus. Ugly. The diseases range from being localized cutaneous infections to being systemic infections. The localized can invade the skin through wounds or hair follicles or glands. Impetigo would be an example of this. And it is highly contagious and it itches. And we'll talk more about this a little bit further along with one of our lectures today. Systemically, it can cause osteomyelitis, where the area that's right at the end of the diaphysis where it meets the epiphysis, it's spongy bone, it's called the metaphysis, and it can be, you can form an abscess there from an infection. And then there's bacteremia, that is where the bacteria move from an infected site or from a medical device and possibly can cause endocarditis and affect the heart valves. The toxigenic disease, you can get it from food, and you can have a lot of gastrointestinal distress. You can get what's called scalded skin syndrome, where you get a bright red flush and blisters, and then the epidermis seems to come off in big sheets, and it's mostly common in newborns and infants. Adults can be asymptomatic. And then, of course, there's toxic shock syndrome, which is toxemia that can cause shock and organ failure. And you can see there some of the staphylococcal disease. You've got on the figure A is showing impetigo, and then the scalded skin syndrome is there on figure B. And you can see how the epidermis just comes off in sheets. It just totally separates. Some other important staphylococci, you've got the coagulase negative staphylococci. That this is a large proportion of healthcare associated and opportunistic infections, especially in patients that have a compromised immune system. You've got the staph epidermis. This one lives on the skin and mucous membranes. It can cause endocarditis, UTIs, or bacteremia. Staph hominis lives around the apocrine sweat glands. Staph capitis lives on the scalp, the face, and the external ear. And those three can cause wound infections if there's a break in the skin somewhere. Then you have Staph saprophyticus that frequently lives on the skin, in the intestine, and or infrequently does, and the vagina, and this is going to cause UTIs. Now, clinical concerns of staph, 95% have penicillinase. So that is an enzyme that's going to make it resistant to penicillin and ampicillin. You also have concerns for MRSA, methicillin-resistant Staph aureus. And some of them are resistant to everything except vancomycin. You can have abscesses that you have to have surgery on, and sometimes the systemic infections require some very lengthy therapy. To treat them, it depends. The Staph aureus, usually cephalexin, sulfa drugs, tetracyclines, and clindamycin. MRSA, as we said, vancomycin. There's also ceftaroline and linezolid and daptomycin. And then for Visa and Versa, the last drugs of choice are quinopristine or dalfopristin. To prevent staph infections, you need, of course, hospital workers use universal precautions to prevent the nosocomial infections. You have a hospital worker that has an infection, they are barred from nurseries and operating rooms and delivery rooms, and they may have to be treated for several months with a combination of antimicrobial drugs. Of course, hygiene and cleansing is paramount in preventing staph infections. There is no vaccine at the current time. Which test differentiates Staph aureus from the staphylococcal species? And that would be coagulase.